Hi, everybody. It was nice to see you all yesterday. And I thought that to try and make things a little more understandable for you all, because there are a lot of expectations in this course, that I would make a little video to go over all the material for you. So I've gone into Blackboard now, and this is your home page of Blackboard, so you know that your announcements will come up there. And I think I have most of my stuff put right into the content. So the first document you'll see is the syllabus, and the syllabus is really good at letting you know what assignments are required. And then I made this calendar for you, so I hope that you find it helpful. I use this in all the classes that I teach. I use a calendar like this, and so you can have an understanding of what's coming up. And I haven't yet devised a way to determine if I can put this on a different calendar. So I'm not, to merge all my calendars, I'm working on that. I did it for my other coursework. But you can see here, we have our standardized patient, and then week 2, and then weekly summative start on the 10th. I pretty much want all of the assignments turned in on Sunday. Now, if for some reason that you are unable to attend clinical that week, or something happens you didn't attend, I still expect you to send me something on Sunday to let me know that you did not attend any clinicals that day. And our first case study through Adobe Connect is on the 17th. And if you click on this, I don't have it set up with the other ones yet. If you set it up on this and then you copy this link that I have attached here, and so I'm going to copy that. I'm going to open a new window so you can see what it looks like. And then you put this in the window. It's going to bring you right to where you need to go. You put your name in there. I'm going to put April, and then you will enter the room. It's super simple, but it is a tool that works fabulous. So I would suggest that you give it a try to make sure that you have the capability on your computer to use that, because you may need to download Flash or something like that, and you don't want to be doing that at 6:55 on the 17th. So check ahead to make sure that you have everything you need. Again, I had some people talking about case studies and when they're due and how you're going to sign up. I'm going to make a sign-up genius for case studies, and so I'm going to let you sign up. Now remember, this case study, it has to be regarding a patient that you've seen. I would prefer that it be something related to women's health. If that's not possible, then throw a topic at me and let me know. Anything outside of the realm of women's health needs to be approved by me first. So I'm going to make a sign-up genius for that. And then when you do your presentation on Adobe Connect, I'm going to fiddle around with the controls so that you will then put your presentation up on Adobe Connect, and you will be speaking to the class like you're the professor. Okay? So let's go back. So that's that one. And then I found these wonderful little snippets, and I will post more as we move forward in the semester. I just thought that these were really important ones to kind of refresh your memory on for the beginning of the semester. And here we have the clinical reference rubric. So with this one, you are expected to put together a book. And I'll tell you what, in other classes that I teach, I advise nurse practitioners to start this right from the beginning. Whatever works best for you is fine. When I was in school and as a new nurse practitioner, I'll show you, I had a book about this size. And I would write down treatment plans that I saw used in practice, because as I was speaking to some of you yesterday, For class purposes, you're going to need to utilize treatment modalities that you're taught. But in the practice realm, once you finally get there, you're going to see that we do things a little differently. So I would definitely, and this is a requirement, so you might as well use it in all your clinicals. Now, some of you, this is your last one, but for those of you that this is your first clinical, get a step up and do this. You'll find it helpful once you start practicing. Here is the rubric for the case study and student clinical calendar. What this essentially is, I would like to have a plan to go out and visit you. So, and I want this to start right away. So let me know. Now, I know almost every Tuesday and Thursday I am not in the clinic, and every other Friday, Saturday, Sunday. I have to go out and visit you at least once. I would prefer it to be in your women's health section, but if that doesn't work out, we can do it with your other one as well. But the sooner the better. I would like to get that done because you will not pass if I haven't gone out to see you in the clinical setting. The weekly summation. This gives you a kind of a idea of what you need to submit to me every Sunday. And I have a really good example that someone gave to me that I'm going to put out also. I think that it'll help you. And so you know what I'm looking for, because every professor is different. The guidelines for your research paper. You already did the standardized patient, so you can knock that one off. So that's a good thing. You're required to do a history and physical, so there's the rubric for that one. What I'm expecting for SOAP notes, what the rubric should be, and what you did this in your standardized patient yesterday. And for those of you that did not give me the professionalism contract, I need to have that back. The evaluation, this needs to be done. Since most of you have 2 preceptors, one has 3 preceptors, it needs to be filled out by anybody that you've worked with. And since this is a 16-week rotation and you split that at week 8, you are essentially going to have 2 full evaluations performed. Standardized SOAP note, that's one thing that you can knock off. And this is the one I put on here today, the NCLEX assignment. This is the one that I had forgotten to put on. So you all should have the Fitzgerald book. It's really a great book. I have to tell you, when I took my certification exam, that's the workshop that I went to. And I used to tell people that I learned more in that 3-day workshop than I did in 3 years of nursing of NP school. And it's really a good one. I would recommend it. Okay, so this is what we need to have you do. You need to take exams from this NCLEX review book. It's got all those practice tests, and it tells you exactly what you're supposed to be doing here. So you need to take the practice tests, and then you need to send me some kind of proof that you took them. So you are going to have to, I think it's a good idea if you just snap a picture with your phone and then you can email it to me right from your phone. So try that and see if that works. But this is a new assignment. It was added on towards the end. So it's something new. And you can see we have our chapters. And it's a good, it's going to give you some great information. And it helps you to study. It's so much better to be studying a little bit all the way through the course than it is to just cram everything in before you take the certification exam. And for those of you that are getting close to being completed with the program, I strongly urge you to take that exam as soon as you can. You're not going to benefit by saying, oh, I'm going to take the summer off, or I'm going to do this. You know what? Get out, schedule your exam, and take it. You'll retain some of that information, and you don't want to have to learn stuff over again. And that nervous anxiety that you have in your body already is actually a benefit to you. So That's all I have to say. I will be expecting your first email to me on Sunday. So even though you have not yet begun clinicals, I expect a communication from you on Sunday, okay? And if any questions or concerns come up, please don't hesitate. Best way to get in touch with me is through email. Okay? Bye.